And we should begin.
Yes.
All right.
Okay.
So welcome everybody to this Asian Pacific hearing on drug use prevention, which is a virtual consultation from civil society within the framework of the Global Initiative of Drug Use Prevention, the Declaration of Oviedo. We're very pleased to welcome you on behalf of ARTM, Proyecto Hombre, and WFAD. My name is Regina Mattsson, and I represent WFAD in this case, and I will be moderating today together with my friend and colleague from ARTM, Augusto Noguera. So with us today, we have two great reporters who are very pleased to have us with us today, and they will take notes and report on this hearing at a later date. And it's Ruth Borges from the Be Cool Project and the Prevention Department of ARTM, and Cressida De Witte, which is our Project and Communications Manager here at WFAD. Today, we have very many important guests who will guide us through the importance of prevention in the Asian Pacific region, and representatives from both the United Nations and civil society. I will hand over to Augusto now to start us off and introduce our first speaker. Before that, if you have any questions on the technicalities, you can write to us in the chat, and we're always happy to see that you send your greetings and tell us where you're from in the chat as well, so we can get to know one another. I'll hand over to Augusto now.
Thank you, Regina. Thank you very much to all that are participating in this Asian hearing, and I think it's a very important subject for the region. That I think that we also have here in the region. We have a lot of potential to develop prevention, and helping us for this Asia Pacific hearing on drug use prevention. We also this year we have the lucky to have the team from the United Nations about the invest in prevention, supporting actually this event and supporting the Oviedo Declaration. So, following that, I'd like to invite our first speaker, Mrs. Giovanna Campello. We are honored to be joined by Giovanna Campello, Chief Prevention, Treatment and Rehabilitation of Section United Nations Office on Drugs and Crime, to provide some introductory remarks. Please, Ms. Giovanna.
Thank you. You can hear me, right? Yeah.
Yes.
Thank you, Augusto, and dear friends. For me, it's a great pleasure and honor to be here. I have basically only one very nice job, which is to thank you, not only for inviting me, of course, and inviting UNODC, but above all for this wonderful initiative, the Oviedo Declaration that you will be discussing today. In thanking you, I just want to let you know why I think this is so important, not only for your region, like Augusto has just mentioned, but for the world. I think that collectively, we have advocated for member states to embrace evidence-based prevention for a long, long time. UNODC produced the standards. Many of you were part of the process. It was more than 10 years ago now. We published 2013, so we started before. And the standards has been endorsed by numerous times by member states. So that is really reassuring. We have member states committed to evidence-based prevention. And this has happened many times. And I think we have seen an increase and improvement in the way our member states. Can you hear me? Yes, okay, because I have a message to say unmute yourself. I say I've been talking for 5 minutes and nobody was hearing me. Sorry, but what I was saying is that I think we have seen an increase and an improvement above all in the way member states promote evidence-based prevention. At the beginning, there was lots of information. Now it's much, much more on the healthy and safe development of youth and children, on the well-being of people in general. And this culminated, I think, in the resolution 3 years ago that was originally sponsored by Slovenia, and but was enjoyed a large and co-sponsorship from all of the continents. And it was really the first time that the spotlight was put on the fact that prevention needs to start from the healthy and safe development of children, and at the same time contributes to the health and safe development of children and to the well-being of people in general. And I am in no doubt that this was also due to our joint advocacy vis-a-vis our member states. Now, what has happened after the resolution? For us, we raised to the challenge and we launched CHAMPS. Maybe some of you have heard about it. I will put the link in the chat. But CHAMPS is a framework. CHAMPS stands for Children Amplified Prevention Services, where we want to go a step a bit further. You know that in the standards, we have many interventions that have been found to be effective in preventing drug use and other risky behaviors. And we want to move from mixing and matching evidence-based prevention, which is already very good, to really creating systems of prevention and show that this works and this really results in better health outcomes for children and youth. We will be, because this is such a huge effort, we will be mostly in a few countries. We are targeting 10 countries, and at the moment, I think we have 5 or 6 that are interested. And in those countries, I am sure that many of you will be, we will connect to many of you. But in general, I think that what is happening with the Oviedo Declaration is even more important in a sense, because with the Oviedo Declaration, you are really advocating everywhere for this evidence-based understanding of prevention. And this is absolutely key. The voice of civil society is absolutely crucial in promoting the need for prevention. And let me underline that we are always talking.
Tell him that they have to put this down first.
Can somebody who has the mic on mute himself or
Trying
herself?
to mute Christina.
No problem. So I was talking about the voice of civil society, and I'm talking, when I say prevention, please let me underline.
Oh, now you're muted, Giovanna. Sorry. Now it's this time you were muted. Sorry about that. Let's see. Ask to unmute. There you go.
I am innocent. Can you hear me now?
Yes, now you can continue. Sorry.
No problem. So I was talking about the voice of civil society and promoting the need of prevention. Let me always underline that when we are talking prevention, it's not that I'm saying that treatment or preventing the health and social consequences, the services for people who use drugs and people with drug use disorder are not important. But I think that within that, it's not a contraposition. It's something that needs to go hand in hand. And I completely welcome a new voice of civil society that raises their voice for the need for prevention, and for within a continuum that protects the health, of course, protects the health of people who use drugs and people with drug use disorder, and that also promotes and protects the health and development of people, particularly children, for obvious reasons, who are not using yet, and that we want to protect from this harm. And I will conclude thinking a bit about the future. Now we have the Oviedo Declaration. What next? I think we should use the Oviedo Declaration together to do 2 things, and I welcome other ideas, right? But this is my ideas at the moment. One, you know that this year at the CND at the high level segment, many member states made pledges many made pledges on prevention. Let's use the Oviedo Declaration to advocate and check that they do good on their pledges, and even better if possible, so that these pledges don't go to waste. And the other thing, let's talk together and use the Oviedo Declaration to advocate with member states and see if there is anybody interested of taking the baton again and push the need for evidence-based prevention forward. We have given member states great tools. Now let's see if we can get a commitment for them to use them even more. And I'm very, very happy to listen to some of your ideas and the ideas that are collectively represented in this virtual room. Let me stop here, otherwise I will take too much time from what is very, very important. And let me conclude again by thanking you. I hope I've given you an idea of why you being here, you having put your weight on the behind the Oviedo Declaration is of such crucial importance globally, especially for the health of people and children and youth. And with this, I wish you all the best, and I'm looking forward to keep on working together. Thank you.
Thank you so much, Giovanna. It's such an honor to have you here with us today. And thank you for not only shedding a light on the importance of evidence-based prevention that starts early and works long-term, but also sharing these tools that you have from the UNODC, including CHAMPS, which is such an important initiative, and these pledges that you mentioned that we can build on to really advocate for the Oviedo Declaration with member states. So I think we all heard what you said, and we will take it upon ourselves to work together to really try to hold our member states accountable to push for evidence-based prevention. So thank you so much, Giovanna. Now I have the pleasure to introduce you to our next speaker, who will give us a brief overview of the declaration in itself. If anybody here has not read it already, I suggest that you do, but I'm sure that our colleague Oriol will give us a perfect overview of this process. Oriol is currently the International Commissioner of Proyecto Hombre and has been instrumental in the work of Proyecto Hombre for over 30 years in different capacities within the field. So we're very thankful to have you here today to guide us through the declaration.
Well, thank you so much, Regina, Augusto, and thanks everyone for joining this event. We are organizing several events regionally. It was hard to imagine how just 1 year ago, when we held the first meeting in Oviedo, Spain, that we would find ourselves in this point today. This initiative aims at raising and bringing together the demand from civil society organizations, but also academia and increasingly governments, that the time has come after decades of drug-related problems to recognize the must to significantly incorporate evidence prevention in drug policy at global and local level, and we don't want to leave any country behind. It is a demand that stems from a real need that we see in the populations we serve every day. I would like to greatly appreciate the commitment and voluntary dedication of my colleagues in the task force and also the country focal points, as well as the 1,560 organizations in 132 countries that already support the Declaration of Oviedo, 25% of them from the Asia and the Pacific region. And the observers, of course, such as the UNODC. The stronger and more transversal our voice is, and the more connected and coordinated we take action, the more strength we will have to convince society as a whole to invest definitely in prevention. That is why we welcome the fact that the United Nations has chosen the theme for the next World Drug Day in June 26, as the evidence is clear: invest in prevention. That is so reinforcing and pertinent. It is certainly the momentum, and I'd love to hear not only Giovanna's words today, but there's a lot of behind and long-standing work to achieve this amazing goal. I don't want to forget to mention my organization, Proyecto Hombre, for supporting me in this mobilization that should last until the next Commission on Narcotic Drugs in March 2025. The message of the Declaration of Oviedo is twofold: do more but better prevention. Many experts work for months to draw up 10 guiding principles that we believe will contribute to enhance the formulation and implementation of more effective preventive strategies. And thanks to the focal points, the document is translated into many languages, the last one in Malay for Malaysia. All information can be found on the website oviedodeclaration.org. You will find it also in the chat box. Regarding Asia, another hearing will be organized for the Middle East region in Arabic. That dates will be announced soon. And my last comment, I encourage all of you to provide evidence-based prevention for everyone and everywhere throughout Asia and the Pacific, and as Giovanna said, particularly children, youth, and people in vulnerable situations or in deprived contexts. Keen to hear from the speakers of the hearing, how they pose the situation of prevention in the countries. The reporters will make a report to be distributed in the region afterwards. So thank you, all of you, very much.
Thank you very much, Oriol, for your introduction to the Oviedo Declaration. And I think it says that all of us also need to say thank you to you. Of course, I know you don't like this, but the truth must be said. And if today we have this declaration of Oviedo, is thanks to your efforts and to your commitment and your idea to develop this declaration and to bring all whites in all the language that is being translated. And also, I think it's very good, this declaration of Oviedo, because it's something that is one of your points is a balance declaration, is a balanced declaration that we not only focus on prevention, but also focus in the other aspects that are very important also to help the people that are having the drug issues. So I think all of us, we are very happy to support the declaration of Oviedo. And thank you very much for your dedication and commitment to the declaration. And without further ado, then the next speaker, I think all of us we already know for a long time. She's doing an excellent job as well in the Fourth Way Foundation. Ms. Diana Vincent, the director. She brings 2 decades of experience with a track record of influencing and working on various child rights, health, safety, and protection issues. As an educationist, has significant projects document insights into different ways communities work on prevention and drug demand reduction programs and response to change. Kerala Insider recognized her as one of the 50 most influential people in Kerala. Diana, please.
Thank you. Thanks, Augusto. Before I start, congratulations to the task force behind the Oviedo Declaration. It's not easy, 1560 supporting organization, 1,560 organizations in 132 countries. That's a humongous task. And congratulations to Oriol for actually leading this team and getting us here. So that's something we have to place on record before I start. And thanks for including my voice, asking me to represent India on this virtual platform, because today, as I speak to you all, India is actually, which is considered the largest democracy in the world, is deciding on its new government, making this election process, according to the news reports, the largest democratic exercise in the history of humanity, primarily because we are such a populous country. The population is so large. So for me, this evening will be very important because the government will be decided, and with that, the priorities of the government as well. And for me as a person and representing civil societies in the country, working on the issue of drug use, drug abuse, and health development, we know that there are various challenges for developing countries. And in this next 5 minutes, I'd like to place on record just 3 important things, considering why prevention is our greatest tool to tackling this problem for countries like us in the APAC nations. One is the size of the problem, because we are low-income countries and we need to really address the size of the problem. Two is the dimension of the landscape of the internet penetration that's causing this to be really not managed rightly by our countries. And thirdly is the investment that's needed in prevention by our countries. So just some realities for what it looks like for India will kind of put the context of the size of the problem. So we're living in a unique time in history for India, at least in the global context, where 1 in 6 people in the world is an Indian today. And that 25 to 30% of the world's workforce in the next decade will be from India. And the youth population is around 45% and rising. So with that comes the complexities of safeguarding the youth and the children, which is 20% of this 45% of youth population are children. And that's they are the children who are going to become teenagers and young adults in the next decade. And safeguarding them becomes our biggest criteria to keep this whole equation in balance. The last decade, many Asian nations or the APAC regions have transformed from solely transit sites along drug trafficking routes to destination markets for synthetic drugs. India is not left behind. We are the largest pharmaceutical hub in the world, and we have our own specific problems, which is dependent around, our synthetic drug problems as well. So according to the Social Justice Department, the first national survey that they put out in 2019, 16 crore people consume alcohol in the country. 16 crore is around 160 million people, which translates into the population of nations like Japan and Thailand put together. 5.5 crore people are people who suffer from cannabis dependencies and opioid use problems, which is populations of Nepal and Malaysia put together. So that's a huge size in terms of the care programs that we need to put out as a nation. And it's only rising. Now it's 21 crores as of the last year's presentation in the parliament. That many people are dependent in the country. A country like India, internet penetration is so large that we really can't get our hands around or grip on the process of the risk of the online platforms and the exploitation by criminal groups. The risk of overdose deaths, online presence of synthetic opioids are significant challenges that we really have to address. Along with this comes the challenges of children being exploited, forced marriages, all of that related around the specific issue of trafficking. So one suggestion to the Oviedo task force is to have a dedicated team to develop strategic advice and plan for addressing the evolving landscape of online drug trafficking, involving youngsters and putting prevention as an online mandate for all of us, prevention work online. The last of it is the percentage of funds that is apportioned by a nation like mine for prevention. So according to the National Action Plan for Drug Demand Reduction, 2% is what we have put aside for prevention, while the Oviedo Declaration says 10% is aspiring, is something to aspire for. We're looking at 200 crores being sanctioned every day, of which 90 is being utilized. The less than half is only being utilized. The rest is not being utilized by the government because we don't know what are the approaches to take. And of the 90 crores, 5 crore, that is 1.6% is the fund set aside for prevention. These are concerns that we can address as nations, because the poorest parts of the society are the most vulnerable. Multidimensional poverty is a reality in all our countries, and in any nation, systems are not capable of functioning to deliver an effective outcome, especially if it is not held to account. And therefore, civil societies like ours play a very important role in holding the nation responsible in safeguarding its youth and focusing on prevention to do that as an effective tool. As my closing statement, thanks to the UNODC for launching the CHAMPS initiative, which is so encouraging for us. We're really looking forward to the impact of CHAMPS and, reiterating the need for prevention. And also the theme for this June 26th, this year, it's so beautiful. We're really proud. Yes, Giovanna, thank you. The evidence is clear, invest in prevention. Like Oriol mentioned, we really wait for this. And this is very heartening for the group that's really working behind prevention. So as it's an important day, June 26th. So I request all of us to join hands in bringing this message that evidence is clear and we need to invest in prevention. So thank you for this opportunity. I really look forward to working with all of you on this group.
Thank you so much, Diana, for being here and for so brilliantly highlighting the importance of safeguarding children, the importance of prevention, especially in a vast country such as India. And congratulations on this historical day. We will be following it from here in Sweden and I'm sure all of the world. And thank you also for the strategic advice to really see how we can better use and implement and evolve, the digital landscape and all of this, because really we are here to safeguard children and youth, and that's one platform that we've yet to discover all of the evidence that we can find. So thank you for leading the way on that, Diana, and for being here with us.
Thank you.
And I have the honor now also to introduce our next speaker, which is our fantastic focal person from Bangladesh, Dr. Iqbal Masood, who is the Director of Health and Wash Sector at Dhaka Asana Mission. Iqbal has been instrumental in spreading this declaration, not only in Bangladesh, but also across the Asian region and internationally. So we're very happy to have you here to share. The floor is yours.
Thank you. Thank you, Regina. Thank you for organizing such a hearing in the Asia Pacific region. Thank you, Augusto and Oriol, for excellent initiative. So Bangladesh, in the not a drug producing country, is a transit country, and very close to Golden Triangle and Golden Crescent. And every year, huge drug traffic from Bangladesh to other Western and other Asian countries. So this is a big concern for Bangladesh government for drug trafficking, and also the traditional drugs that produce like cannabis and some liquor, country liquor. And now, day by day, the drug users is increasing, and the high income group to low income group, and every segment of the society are affecting. There is no barrier and no segments are a special segment for the drug users. So all segments are affected. So estimated 7 million drug users in Bangladesh, and in the different patterns, most of the drug users are youth. And recent year, we observed the children drug users are increasing in Bangladesh. So this is another alarming for Bangladesh. And Bangladesh drug demand reduction and drug supply reduction and harm reduction is basically focused on supply reduction. And in Bangladesh, 2018, the government declared war on drug and zero tolerance. And that time, the many people killed by the law enforcement agency. And you know that this is not a scientific and evidence-based approach to drug control, and not effective also, not proven by research. So after that, the government is very concerned to still supply reduction is a focused, and maximum budget allocated for the supply reduction, and demand reduction is less priority among the government initiative as well as the civil society. You know, the civil society is the hub of Bangladesh. Is thousands of civil society working for socio-economic development sector. But in the drug field, is a very few organizations working because of the limited funding and government support and donor support. So this is the big challenges for the Bangladesh, inconsistent drug demand reduction and traditional drug demand reduction approaches, like some few awareness program is in the drug demand reduction without any evaluation and research. So now is a very important time to bring this issue in the national level and in the front of the policymakers to incorporate the evidence-based and scientific drug demand reduction program in national level, and as well as incorporate the civil society organization. Therefore, we are recommending the uniform and evidence-based approaches need to be taken by the combining different strategies, which is would focus demand reduction, supply reduction, and harm reduction, including the treatment. And the Oviedo Declaration. The Oviedo Declaration is very much aligned with the UN Declaration and international standard on drug use prevention of UNODC and WHO. That's why if we promote the Oviedo Declaration, then government will listen us because this they align with the UN declaration and complying with the UN strategies. And we have some recommendation for the government as well as the UN organization for allocating budget, more budget for the drug demand reduction and prevention program, and mainstream the evidence-based prevention program to sustainability for the context of the sustainability, and engagement of the multi-stakeholder in the prevention program. You know that if we made the drug prevention program is a cross-cutting issue with the other development program, that it can be sustainable and more stakeholder can be engaged for the drug prevention program. So this is the right time to bring it in the national level. And if we promote the Oviedo Declaration in national level, that it will stop counterproductive prevention program, which we are running at present, because we have no research and evaluation in our prevention program. So the counterproductive prevention program sometimes hampers our true prevention among the youth and children. So, and finally, we recommend for accountability and good governance is the very important factors for the demand reduction program. Corruption is a big issue in the low and middle income country. So accountability and good governance need to be bring together with the prevention program. Finally, the 10 principle and guiding principle of the Oviedo Declaration can be the way forward for the prevention program, especially for the low and middle income country like Bangladesh and others. So this was my few recommendation and our challenges. So hope that we can make more discussion in the global level and the country level, national level, and we can engage more stakeholder for the future. We need to engage. So the policymakers also need to bring together in our discussion so they can incorporate this declaration and guiding principle with their planning and activities. So thank you for the organizer and giving me the opportunity to talk a few words from Bangladesh. Thank you so much.
Thank you very much, my friend Iqbal. Thank you for your introduction of the situations on your region, on your country. It's not been easy when we have a lot of fluctuations on the drug policies and the politics. But I hope that the Oviedo Declaration, together with your effort, and I know that you were able to involve a lot of local NGOs coming to the Declaration of Oviedo. So I'm sure that all of you together can also make efforts to improve the things on your region, country, and that the Declaration of Oviedo, that is a very balanced approach that have prevention, have also continued care of service, and that and other problems like corruption, etc., that can help to achieve what you went for. We can have a better drug policies as well in the region. So thank you very much, Iqbal. And our next speaker, it will be from Japan, the focal point from Japan, Mr. Akira Fujino. I think he's not online. So, but he has sent a previous video recorded. He's the president of the Drug Abuse Prevention Center, joined the United Nations in 1980. He was stationed at Vienna for a total of 25 years, and also between Bangkok for 5 years, mainly in charge of the international drug control. So he's a person with a lot of experience. Served as a deputy secretary, International Narcotics Control Board from the INCP, representative of UNODC, from the Regional Center of East Asia and the Pacific, which means in Thailand, and special advisor to the executive director UNODC. Currently, he's been working at the APC and is very collaborating and supporting funding to the UNODC, so can be distributed to the other institutions. And we go to him.
My name is Akira Fujino, president of the Drug Abuse Prevention Center, DAPC of Japan, among other things. It is my pleasure to address this webinar. Since 1993, DAPC has been playing a leading role in the nationwide drug abuse prevention campaigns. The Center has simultaneously carried out fundraising activities to support developing and mid-income countries through the United Nations Office on Drugs and Crime. The collected funds have been donated annually to UNODC and have so far been used for 780 drug abuse prevention projects in a total of 649 countries. In March last year, during the session of the Commission on Narcotic Drugs, Japan organized a high-level side event to commemorate the 30th anniversary of the DAPC grants. This year, together with Uganda Youth Development Link, we held another side event at the CND session, which was a direct follow-up to the proposal we made last year. The proposal was to form an informal international platform anchored on preventing non-medical use of drugs, particularly among the youth. At this juncture, I would like to recall one thing. Half a century ago, by amending Article 38 of the 1961 Single Convention, the international community firmly stated its intention that the prevention of drug abuse is the first and the most important step to address drug abuse issues. And at the same time, the amendment provided that all measures should be taken, beginning with primary prevention and continuing with early identification, treatment, education, rehabilitation, aftercare, and reintegration into society of those concerned. All those measures must be taken in unison, with no one element missing. I would like to re-emphasize that the purpose of the DAPC grants program through UNODC, which has continued for 30 years, is to send a firm message from Japan that the first priority is to take all possible measures to prevent drug abuse. We think the time has come to create an informal international platform of regional networks for discussion and collectively taking action on prevention, with the private sector as a primary driving force. In today's world, there are countries that urgently need to address the worsening drug abuse situation, and we think it is precisely in those countries that prevention efforts are essential. It is time for like-minded organizations to take this opportunity to come together and join forces to sow seeds towards building an informal international platform anchored on drug abuse prevention. We are about to take the first step in this direction. The informal international platform we hope to organize will begin on a small scale with a number of like-minded groups and organizations, and with the aim of planting the seeds for further creativity in drug prevention efforts. The next concrete step we envisage includes organizing a regional forum, perhaps somewhere in Japan, with the aim that it will be replicated in different parts of the world and form an informal international platform, a mechanism to share actual experiences and thoughts. There's no single remedy that fits all. We need to be innovative, and we plan to continue our dialogue with you. Thank you very much for
Fantastic. We're very thankful to Mr. Akira for joining us virtually with this recorded video. And I think that we all learned a lot, and we look forward to seeing more of this initiative that he mentions. So we will follow that in the coming year and offer our support on behalf of the Oviedo Declaration to Mr. Akira as well. Our next speaker is, I believe, possibly in Brazil, but representing Pakistan today, Christina von Sperling, who is the founder and chairperson of Karim Khan Afridi Welfare Foundation. We're very happy to have you with us today, Christina, and I'll hand over to you.
Thank you so much. Very happy to see so many familiar faces together here tonight. So we are here today as we are aware that implementation of drug use prevention strategies is falling short worldwide, and Pakistan is no exception. With 250 million, the population of Pakistan reached 9 million drug users, and with the youth bulge of 150 million under the age of 30, it faces mounting challenges to protect its youth from the harm that drug use brings. Like elsewhere, drug use is rising to alarming levels, escalating beyond control, especially among adolescents in education institutions. In just 1 decade, as we know, the use of drug has grown 23% globally. With this upwards trend and the diversification of synthetic drugs, the need for effective prevention program has become paramount. Prevention is proven cost-effective, and evidence-based prevention can reduce rates of drug use and drug use disorders. Early prevention strategies can successfully counter the risk behavior which attract youth to a flawed, glamorous life of drug use. To me, it's simple. More drugs, more violence, more crimes, more militancy, more lives lost, and the future destroyed. So drugs are a health and security threat now acknowledged nationally by the government and civil society. Dear friends, Karim Khan Afridi Welfare Foundation this year marks a significant milestones in our journey. It is the 10th anniversary since we lost our son Karim, in whose memory KKAWF was founded, to draw attention to address the menace of drugs through awareness and early prevention education as a priority. Though the government recognizes our work, implementing prevention program is beset with many challenges in Pakistan. First and foremost, prevention strategies are not given a priority as part of countering the drug problem. The thrust of government policies is on the anti-traffic, and the civil society's focus on rehabilitation service, it being a more lucrative business compared to prevention programs. Even where prevention is stated as policies, it is not followed by action. Let me list the key challenge in implementing drug prevention in the country. A stigma around drug use and opening a dialogue on this issue. This drives a lack of support for implementing awareness and prevention programs. Lack of financial resource available from the government and international organizations. In Pakistan, competing priorities are a constraint to support prevention intervention. Lack of infrastructure and has shortage of trained personnel. Teachers have not the skill set, understanding, capacity to implement prevention programs in schools and community. Although we are implementing the European Union program that you all know and familiar with, we are doing that, culturally adapt, call Hamsat. So lack of coordination among different government agencies responsible for health and narcotic control. Lack of research and data availability. Last survey done in Pakistan, it was in 2013 by UNODC and government of Pakistan and the INL. A new survey, it seems to be on the way now after more than 10 years. So without current data highlighting prevention suffers, without that data evidence, prevention strategy remain distant. Comprehensive data on drug use pattern and trend is key to developing effective prevention. Countering the glamorization of drugs by entertaining industry, the young population is lured into the flawed image of a life of glamour offered by drugs, plus the so-called influencer on social media. Blind eye to integration of prevention into educational curricula and providing continuous training for professionals. So now I share work that KKWF on prevention is doing. So since 2015, KKWF has, with its dedicated effort of policy advocacy and outreach, taking a lead to break the stigma around drug use and build partnership with public and private sector agency and education institutions. We engage with youth through our awareness and prevention and life skills education program, implementing use of our 5 pillars, which are drug awareness primarily, environment, sports, arts and culture, and developing civic sense. So as well as annual events to mark International Drugs Days. With our slogan, helping youth to identify, understand, and manage emotions, we make the youth understand the value of staying clean and to protect themselves from the danger of drugs. It has reached out to thousands of youth to guide them to build a system of self-defense and prevent them from falling into the trap of drugs. We have recently launched a Lahore chapter in the biggest province, Punjab, through which we plan to engage in the capital the 8 million underage 30 young population towards awareness and prevention education. We are working to make the youth understand that a life without drugs is indeed the glamorous life. So in conclusion, while the challenges are substantial, they are not impossible, and by promoting political will, prioritizing fund, fostering collaboration, and building capacity, Pakistan can move towards a more effective and inclusive drug prevention strategy. Together, we can create a healthier and safer future for all. KKWF fully support the Oviedo Declaration to make early prevention the most experienced strategy to combat drug use. And I, with the UNODC team of this year invest in prevention, I think that it was a great support for us to get more attention and support from the, not only for government, but from the community itself. Thank you so much.
Thank you very much, Christina, for your efforts and dedication in working in such a difficult environment. And as you can see, it's not easy because here in Macau, we can talk about 100 people. You talk about millions of youth. So it's a very hard job, and we are very thankful for your dedication. We also hope that the Declaration of Oviedo and with this year team of the UNODC can also help, and we also can help you to contribute for a better drug policies and more investment in prevention in the Pakistan. And the benefit, it will be the youth, the children, which are the future of the world of tomorrow. Thank you very much. And without further ado, then I would like to invite the focal point from Maldives, Mr. Ali Adib. He's from the Global Drug Demand Reduction Trainer, Journey NGO. Is a certified addiction professional and a lecturer on prevention, treatment, and recovery support service for almost 2 decades of experience. So please, Mr. Ali, floor is yours.
Thank you for the opportunity, friends. Most of the people I see here are colleagues that we have met throughout our work. For decades, the Maldives has been locked in a reactive struggle against drugs. We very comfortably ignore the risk factors and utilize the limited resources we have to react to issues when they arise. Now, we see that this band-aid approach has only worsened the crisis. We see it in the flourishing drug networks, the rise of gangs, black markets, the fracturing of families, rampant corruption, violence, extremism, and the despair clouding our communities. Our overflowing jails, more than 85% of the prison population are people who use drugs. We have established a culture of incarcerating people who use drugs and releasing traffickers. Our rapidly decreasing age of initiation, 8 years, according to a research in 2022, drug availability in all the corners of the archipelago, children being groomed as drug peddlers, and the alarming escalation of drug supply are testament to our failed responses. Now, the institutions that were created to combat this crisis are actually stagnant and putrefied. They need to be reanimated and injected with a healthy dose of commitment to serve. Successive governments have used the drug issue as a political football, describing it as the biggest challenge facing the country before elections and comfortably neglecting it when elected. We need an administration with the courage to confront this challenge head on, one that prioritizes an evidence-based national strategy. We need a leader, a government with a dedication to tackle this problem in a strategic and sustainable manner. We do have a tool at our disposal. The Drug Act 17/2011, which was brought forth in 2011. It remains largely ignored. Instead, we are spending exorbitant amounts of money on reactive policies and strategies with no evidence of success. And as advocates who played a role in crafting this act, we demand its full implementation. Now, prevention is the cornerstone for tackling drug use. Treatment and rehabilitation, as Giovanna mentioned, are crucial. But without prevention, we are simply filling a bucket with a hole. Now, research by the Washington State University for Public Policy shows that every dollar invested in evidence-based prevention saves up to $400 in future costs. This is a win-win for our society and our economy. Evidence-based drug prevention in schools can prevent drug use together with many other issues, such as mental health, school dropout, violent behaviors and delinquency, risky sexual behaviors, and help increase school performance. The Oviedo Declaration actually echoes our call for prioritizing prevention. Its 10 proposals, if enacted responsibly, can turn the global tide on drug use, mitigating the harms of drug use to individuals, families, and our communities. We support it fully. We stand ready to present this very important document, translated into our local language, Divehi, to our government, and we want to share it with our people. Building widespread support for its implementation is vital. We must invest in prevention, stopping drug use before it begins and intervening before the development of drug use disorders is crucial for the healthy development of our children. Evidence-based interventions are key to breaking the cycle of failure. Reactive, politically motivated strategies based on guesswork are not only ineffective, but they harm our communities. We need research and skilled human resources to fight this fight. We must move beyond reactive policies. The cycle of waste in resources, neglect, and ineffectiveness needs to end. We need to build a future where evidence guides our actions, prevention shields our communities, and hope replaces despair. As most of our countries work together on mitigating supply, we need to work together on drug demand reduction, sharing resources, and success. I actually second my friend Akira's idea of a platform to further the cause of prevention. Now, the UNODC World Theme for Drug Day is on point. The evidence is clear. Let's invest in prevention. Thank you for your time.
Thank you so much, Ali, for this inspiring and fantastic contribution, really highlighting the fact that we need to work together for drug demand reduction and showcasing that evidence-based prevention is so important. Not only is it cost effective, and that's something we can use when we're holding our governments accountable, but also has this mediating effect in that good prevention, good evidence-based prevention also can decrease the likelihood of other risky behaviors and increase school achievement, mental health, and so on. So thank you so much for your contribution. It's a pleasure to have you here, and I look forward to work together in the coming months continuously. Our next speaker is coming from Australia, Mr. Shane Varco, who is the director of the Dalgarno Institute, which is a long-standing alcohol and other drugs community-based, not-for-profit, public interest health education charity. And it's my honor and pleasure to welcome you, Shane. The floor is yours.
Thank you, Regina. And look, thank you for the opportunity to be part of this outstanding and I think well overdue initiative. And I want to echo the sentiments of those who already shared that. I don't want to repeat those. I think they're well stated and well heard. To frame up the commentary today, I asked to share a little bit about sort of the commentary on the Australian context, as it were. But I want to introduce a bit of research that came out of the US only just over 18 months ago, in fact, out of Illinois. And the research included more than 128,000 students, young people, in grades 8, 10, and 12 from Illinois schools. And they looked at what are the protective factors, one of the best protective factors in delaying or denying uptake of substance use. And they said this interesting, they found that individual beliefs that drug use is wrong had twice the magnitude of impact compared to other risk factors and protective factors examined in this study. Thus influencing adolescents' beliefs about drug use may be an important, and the researchers have argued, a relatively underemphasized key to modifying delaying uptake. Now, in the survey, youth were asked how wrong they think, this is their words, it is for someone their age to consume alcohol or other drugs, ranking from not wrong at all to very wrong on a 4-point scale. For each unit increase in response, the likelihood of past year drug abstinence, get this, increased 39% for grade 8s, 50% for grade 10s, and 53% for grade 12s. This data is not shared very often. It's interesting, isn't it? And the idea, the beliefs about substance use and conduct correlate well. The researchers said this makes a lot of sense. Now, I wanted to open with that because it does inform to a certain extent the success and some of the failings of the Australian drug policy interpretation and application in our context, particularly as it relates to prevention and demand reduction. Demand reduction is the key element here, reducing demand for substances. What are the drivers that are going to help us achieve that goal? Firstly, it's important to note, for a bit of history for those who are not familiar with the Australian context, that we opted out of the war on drugs in 1985 when we launched our first iteration of our national drug strategy. This important, very important, 3-pillared strategy, demand reduction, supply reduction, and harm reduction, conceded that substance use was here to stay and could not be eradicated, only managed. So that's a very important factor. That's been part of the strategy ever since, and it's been working in that context. Demand and supply reduction, in fact, the last iteration, which is currently in play, put demand reduction as the first priority. And the difficulty with that is, on paper, it's in there, but it's not played out as such in our context, given the priority that it has on paper. But obviously, demand reduction and supply reduction go hand in hand, and it's important that the harm reduction policy, very important harm reduction policy, should be used to support those two frameworks, and they should not be in contestation with each other. Now, then we have 3 substances in our current platform: tobacco, alcohol, and illicit drugs. Just quickly on tobacco, Australia is arguably the world leader in reducing smoking. In 1945, as a matter of history, about 52% aggregate of Australians 16 years of age or over were smoking daily. That's a huge context. Now we're down to about 14%. Now, it took about 3 or 4 decades to implement this strategy and see this work effectively. But it's interesting to note that the key, final and sustained strategy for this success was our Quit campaign. Very interesting. After a long war against big tobacco's well-funded propaganda, the unequivocal Quit strategy emerged. Now, this is really important. There is one focus, one voice, and one message in the public square, and that is quit. Now, there's obviously realizations that there's a journey to cessation and there are problematic issues on the way, and we address those, but the goalpost hadn't changed. It's quit. It's cessation is the goal. No other goal but cessation. There is no dissenting voice and there are no mixed messages in the marketplace, in the public square, in government, media, education or health. They're all on the same page. There is no dissenting voices in those contexts. Very important distinction in that policy deployment. Smoking is bad for you, and that message is sustained consistently. Now, when it comes to, we could drill down to other factors on that, but time won't permit us to look at that. Alcohol has been reined in the last probably 10 to 15 years, particularly as our involvement watched this happen. It's been reined in quite heavily, and we're seeing the messaging now in the public square is now be responsible. So consume responsibly. Interesting dynamic because the nighttime economies and the amount of alcohol contributes to our economy is huge. So it gets a lot more traction in the socioeconomic space. Our Aboriginal communities, dry community models are working for the most part when either agreed to or facilitated by community elders. Very important. When that's in play, this actually works. And the FASD issue, the fetal alcohol spectrum disorder issue, is quite a concern in our Indigenous communities. And one of the reasons for these dry communities being evidenced. But it's also important to note for those who are not familiar with the Australian context, that the alcohol misuse per capita is less in our Indigenous communities than it is in our non-Indigenous communities. When it comes to illicit drugs, the policy interpretation around this genre of substances is vastly different from the others. It appears quitting is not really an option. As much as, obviously, harm reduction, we want to see people looked after, and recovery is a really important factor. The cessation dynamic is not heavily put forward in our marketplaces at all. And unfortunately, those mantras have been misused because the harm reduction model is incredibly vital and we laud it and promote it. But when it's misused to normalise drug use rather than actually help people exit into recovery spaces, it becomes problematic, and it becomes competitive and or becomes contradictory to the supply and demand reduction frameworks. Cognitive dissonance, I think when it comes to, and just closing with this, when it comes to impediments to prevention, particularly demand reduction in our context, I think cognitive dissonance in the marketplace is the single biggest issue. The policies are good. The frameworks are good. I think it's interpretation and deployment that are the problem. And again, the messaging is a clear issue that has to be addressed. And I think demand reduction has to take the policy levers in this context and better leverage it to see demand, particularly demand for drug use to be dealt with, and delaying and denying of uptake be given a far greater priority, because inadvertently the cognitive dissonance has generated a passive normalization of drug use for our young. They're beginning to see this as a kind of, okay, well, this is kind of normal behavior. Adults do it. We're going to sort of do this. And of course, initiation starts even younger as young people want to embrace the adulthood frameworks that they find themselves in. So the concern for us is that, and we promote and are completely on board with anti-stigma legislation, and we use that appropriately. But when unfortunately language and speech codes can actually interfere with the ability to call out particular messaging that's not helpful, as we have with the Quit campaign, tobacco is bad for you, cessation is the goal. I think we need to have a far more clear message in the marketplace in our demand reduction frameworks, along with all the other protective factors that are vital and imperative, including resiliency building, which we have launched through the Dalgarno Institute World Resiliency Day, World Resiliency Week, because we understand that there's a lot more involved in familial constructs and community constructs, and building resiliency in young people is imperative. And what undermines that resiliency quicker than most other things is the engagement with substance users. So that, in short, that's kind of the issues that we're addressing, and we'd like to see that dealt with that cognitive dissonance dealt with in our marketplaces, so that a clear messaging for young people that substance use is bad for you is and that there are better choices moving forward is a priority. Thanks for that.
Thank you, Shane, for your introduction of the Australian contest, and as you can see, it's a different contest, different situation in comparison with the other countries here in the region, and it's a good points that you mentioned about alcohol and tobacco, and the differentiation that exists on promoting those items, and at the same time comparing with the drugs, which is very, very different, and which can lead to a lot of confusion to the young minds, and to the children, to the youth. And of course, all of us, we accept and we understand that quitting, it must be an option and not an option. So we all need to put that, we all need to work hand to hand, and involving all the factors for the benefit of the better drug policies. And thank you very much. And without that, we'd like to invite our next speaker. It will be the focal point for Malaysia, Dr. Hamad Farouz Mohamed. He's the president of the Green Crescent Malaysia. And please, the floor is yours.
Assalamualaikum and good afternoon, everyone. Okay, first and foremost, thank you very much and for Mr. Augusto and all the committee members and to all the association from all the other countries. I'm excited to hear all your sharing. I'm interested to know your sharing about you are talking about protective factors and laws and policy. So in Malaysia, we want to share also about related to our law, Malaysian law regarding the drug related policy, and also what we are doing for the drugs and substance abuse. Basically, in our latest data, 2023, among the drugs and substance abuse, adolescents is about 1%. For youths, is 62.1%, and adult about 36.8%. And male is the majority, about the 95% of the drug abuser and substance abuse. Okay, that is about a bit about the statistics so that you understand the scenario in Malaysia. Okay, basically drug trafficking is about the logistic area, the geographical areas of our countries, and so therefore we have law related to the control on drug use prevention. Drug trafficking law is regulated under Malaysian Dangerous Drug Act since 1952. In our law, stipulates the death penalty for certain trafficking offenses involving specified amounts of drugs. So this amount vary depending on the type of the drugs. For instance, trafficking in more than 15 grams of heroin or morphine warrants the death penalty, while trafficking in more than 200 grams of cannabis and carries the same penalty. So this under our Dangerous Drug Act 1952. For the drug possession of illegal drug is covered under Section 12 of Dangerous Drug Act. Penalty of possession depend on the time and quantity of drugs. Certain amount can result in imprisonment and or fines. For the drug abuse is addressed under various provisions of our Dangerous Drug Act and the drug dependent. This law provides for compulsory treatment and rehab for drug addicts, as well as penalty for drug abuse offenses, including fines and imprisonment. Medical marijuana, so this is quite a hot topic nowadays, is classified as a controlled substance under Malaysian's drug law, and possession, sale, or trafficking of marijuana is still illegal in Malaysia. Okay. So I would like to share about what we do regarding the protective factors that we have discussed. So basically, we have the government agency on top of, we supported by also a few NGOs related to drugs. Okay, so our government agency, the main, we have the National Anti-Drug Agency, we call it the NADA, for responsible for coordinating and implementing drug prevention, treatment, and rehab program nationwide. So it conduct awareness campaigns, school outreach program, community-based initiative. We have congregate our effort from the NGO to do with the higher institution as well to do education and awareness. So drug prevention effort in Malaysia emphasize education and awareness, raising activities targeted at different segments of society, including students and parents, teachers, and community leaders. This initiative aims to increase knowledge about the risks and, of course, to increase their coping skills and resist the peer pressure and promote positive values and behaviors. Community-based program we develop through the NGO play a crucial role in drug prevention effort by organizing outreach program, support services, advocacy campaign, and grassroots level. This organization works closely with local communities, activities, and families, and especially we provide counseling and support service to individual and family affected by drug abuse and promote community resilience and social inclusion. Because we can see from some statistic that those who are low educational background, those who are vulnerable, they are more tendency to have all these as the drug abuse. And then we also do some school-based program, especially our Green Cancer Malaysia is very active doing the school-based program. Drug prevention program are integrated into the school curriculum to educate students about dangers of drugs and the most important to empower them to make the healthier choice. This program may include classroom lesson, workshop, and we have the extracurricular activities designed to build student resilience, self-esteem, and decision-making skills. So therefore, that's why when we are approached from the organization to support the Oviedo Declaration, because these are aligned with our efforts in Malaysia through our national and also NGO. With that, thank you very much for the opportunity from Malaysia.
Thank you so much, Dr. Ahmad. Thank you for showcasing the situation in Malaysia. I think it sounded, you said, 1% out of the youngest population, 62.1 out of youth have substance use disorders, and that's really showcasing the importance of prevention, having to start early with such a large portion, of the young people being affected by addiction. So thank you so much for showcasing the ways in which you're collaborating, not only with families and children, students and schools, but also with national stakeholders. Thank you for being here with us today and for that. Dr. Ahmad was our final speaker. We thank you so much for your contributions. We now will give a few moments for you to send, if you have any questions or comments in the chat or in the Q&A box. And then during that time, once you consider potential questions, I will hand over to Oriol to tell us a little bit more on how to get involved with the declaration.
Oh, thank you so much, Regina. This initiative is very action-oriented, as you can see. So what about next steps? No? I also want to record about other great focal points that we couldn't ask all of them to present today. So apologies for that, but they're doing great work in Mongolia, Cambodia, Nepal, Indonesia, Kyrgyzstan, etc. So also wanted to recall that. You can also replicate this sort of hearings or webinars nationwide. So we can also support as a task force on this if you consider it would be good for your approach and strategy at national and local level. Also that we will be organizing the next one for Africa on July 2nd. We will send information soon. And the report that Cressida and Ruth are taking notes and will make this report of this hearing will be distributed not tomorrow, but on the following days, not only to you, but to key stakeholders in the region of Asia Pacific. So tell us also if we want us to send to any particular stakeholder, but you can also use this report as an additional advocacy instrument for your purposes. Okay, and thank you so much for joining and all your support.
Thank you so much, Oriol. And I think it was all very clear because we have some very good statements both in the Q&A and in the chat. It seems like the situation in the Asian context is similar to the Central African Republic, who also has a problem with the young people and that they need to work together to reduce the phenomenon. We have some more comments there. I'm sure everybody can see them. But I think if we don't have any further questions, you're most welcome when we send out the information later on to send any particular questions that you might have. And we'll ask our panel to present them or to answer them, and we'll send out. And then we also will have hearings for other regions that you're most welcome to attend as well. So the African hearing will be on the 2nd of July. And you can always join the different hearings. And I think Oriol mentioned the MENA hearing will happen sometime in September, possibly. We'll send out some dates for that. So without further ado now, I will stop speaking and hand back over to my moderation colleague, Augusto, to give us some final words.
Thank you, Regina. Thank you very much. There's one gentleman, Mr. Efran Biraji Kazole, on the making a question that would like to have a translation in French. I don't think if you're asking for the translation from this webinar in French, it will be difficult. But if you want the translation of the Oviedo Declaration in French, you can go to the Oviedo Declaration website and you can have the declaration in French there.
Here.
Yes.
Can you hear me?
Yes,
Okay.
we hear you. I think we have.
Someone was.
Yes. No, it's good. And just to answer, there's a question also on how African NGOs can work with this declaration. And you're most welcome to join hands with us from the African countries as well. There are some translations into different African languages, Swahili, for example, available online. And we have focal persons also from the different regions of the continent. And on 2nd of July, you're most welcome to join the African hearing, where we will have representatives from NGOs from across the continent as well. So we'll send out a link to register with that when we send out the report from today as well. Back over to you, Augusto.
Thank you, Regina. So I'd like to, on behalf of the task force, to thank you to everyone for your contribution today to this hearing, to spend some of your time to be here and sharing the situation of your region, on your country. And I believe after hearing your interventions, your experience, and on the prevention field, your knowledge and necessities and the differentiations that you can see how the governments tackled this issue. And if we compare with the declaration of Oviedo this year and with the theme of the World Drug Day, the evidence is clear, invest in prevention. I believe that we all have a lot of work to do to amplify the drug prevention in the world. But since we are working here, this webinar is about this region, Asia, so also as well in this region and the Pacific as well. So that I think that the drug prevention, as stating also in the UNODC website, 26th of June, we need to guide by the principles of the science, compassion, and solidarity. And I think that is very important issues that here in the region that sometimes we know that is very very pressured by the law enforcement in levels that we also we think that is not human. We also need to work and to make understand that some drug policies need to change. I believe Asia and the Pacific, mainly Asia, it's a region with high potential to develop a balanced drug policies. And have the lucky to have a few weeks ago Ms. Gadawali, the executive director of the UNODC here in Macau, and she mentioned about the importance to have a balanced drug policies. And when we manage about a balanced drug policies, we manage treatment, prevention, social reintegration, and harm reduction. And all of that need to have a balance and work together so we can achieve good results on the drug policies. And I believe with the efforts from all of us together with the tools of the Declaration of Oviedo, the team, we have a lot of tools we can continue doing a very good work, and we have the support of the city always on our activities, and we also can continue working together, organizing more of these webinars, like Oriol was saying, and so we all can discuss together and how we can influence our governments and to improve the drug prevention in our region. And I think that's all that I have to say. And thank you very much. And let's continue working together. And Regina, Oriol. And I'd like to say thank you to my staff as well, that she have the hard work to be a rapporteur. She there as well.
Goodbye, everyone.
Goodbye. Thank you, everybody. Thank you.
Goodbye.
Thank you all so much.
Thank you.
Take care.
Yeah, bye.